As the coronavirus pandemic took the world by storm, for the first time, many people in developed countries understood what it is like to lack access to essential medicine they need to survive. For people in poor countries, lack of access to medicines has always been a problem. This podcast explores the access to medicine issue and how we can promote global health more broadly. Famous scientist Marie Curie once said, "Talking is the best medicine." In this podcast, we will heed the advice of Curie and discuss how we can ethically and effectively tackle the health challenges currently affecting our world. Throughout this series, we will break down and explore fascinating new research being conducted by leading researchers and activists in the diverse field of public health who've dedicated their lives to understanding the problems and identifying the solutions to health crises that impact millions of people around the world. So sit back and enjoy this episode of Talk is the Best Medicine, brought to you by Global Health Impact Project in partnership with planksip.
Dr. Esther Chirwa-Mkandawire holds an MSc in vaccinology and drug development. She is currently working with the Ministry of Health expanded program on immunization as a vaccine safety officer. She is a member of the National COVID-19 Vaccine Task Force, which is responsible for COVID-19 vaccine rollout and implementation in Malawi. Esther Chirwa, welcome to the show. Now, Esther, I'd like to start off by having you tell us a little bit more about yourself. Really, how did you get into this field, and how did you get interested in global health and working at the Ministry of Health in Malawi?
All right, thank you. So as you have said, I was born in Malawi, raised in Malawi, done most of my education in Malawi. So first of all, I wanted to be a medical doctor because I wanted to help people, like most medical doctors. And after my training, I went to one of the rural districts in the country. So when I was there, I noted that most of the children that were coming to the hospital were coming in with vaccine preventable diseases or infections that could potentially be prevented using vaccines. So apart from that, they were also coming in with things like malaria, diarrhea, which can be prevented using other public health measures like having clean water, and so that's why I was interested more in going towards public health and making sure that we prevent diseases, especially in the young children, because unlike adults, young children, most of them really die after catching such infectious diseases, while adults can fight the infection and then get better. So with the impact that vaccines have, and seeing also that the vaccine coverage was not so good in the district, that's why I chose to do a master's degree in vaccinology. And then after coming back, I saw that maybe I could also help my country better if I'm involved at the national level. So that's how I ended up in the Ministry of Health.
Well, that's really interesting, commendable, and it adds a lot of context, about your history. We have some questions that we'd like to ask you about vaccines in Malawi. So, the questions. This question has to do with vaccine approval. Now, can you speak generally, but how has COVID-19 affected the general health for your country? For example, many cancer specialists in the United States are worried about an increase in cancer due to the routine checkups that are, important for early detection are being missed because of the pandemic. How is COVID-19 affecting other diseases in Malawi? Are people still able to get treatment for HIV and other diseases?
Treatment for other conditions is still available. Of course, it has been in two different phases. So when we had COVID-19 at the peak, for example, most of the surgical procedures had gone down because we were trying to decongest the hospital. So elective surgeries were not being done. And maybe for people with HIV, as you have said, we were giving them a longer drug or a bigger drug package. So instead of giving them medication for 1 month, we would give them medication for 3 months, for example, if we saw that they were stable. So that was also the same for other people with chronic conditions like diabetes, hypertension. Would give them drugs that would carry them for a longer period of time to make sure that we decongest our clinics, but also reduce exposure. Because most of the people here use public transport when they come into hospitals, and then preventive measures were not as strong. So to reduce exposure, we made sure that they were not coming to the hospital as frequently. But the other services all the other services were available. So emergency services available, emergency surgeries available, ART services available, and OPD services were also available. And one notable thing was also that, and it still is now, that people are not so willing to come to the hospital because they think that if they come, especially when they have a fever and a cough, they'll have a diagnosis of COVID-19 made, and they think that there are many stories going around in the villages regarding COVID-19. Some say that it's made up, and maybe when a diagnosis is made, people are killed in the hospitals. So that has also made or discouraged people from coming to the hospitals. But we're still giving out messages, messages related to COVID-19, so that they understand what it is, and then they still come to the hospital to get different services that they need.
Yeah, that's very interesting. I think we should perhaps jump to a few questions about vaccine hesitancy. I think that's very appropriate here. So, how has COVID-19 changed Malawi from the lockdowns and other restrictions? How has it affected the younger generation, for example? And are they concerned about contracting the virus? You know, the younger people, younger kids and stuff.
So I think the younger generation has mostly been affected in terms of schools closing, because as you can see, my internet is poor here, and most people do not have access to internet. So when schools close prematurely, that means that the children will just be staying at home and not really have access maybe to online or virtual learning or other learning platforms. So that has really affected, I can say COVID-19 has affected the education system in the country. In terms of risk, children do not really feel that they're at risk of catching COVID-19. And that has also been reflected in the statistics of COVID-19 infections. We've seen very little numbers of children being infected, and most of them not having mild or moderate infections, but not serious infections. So the young ones don't feel that they're at risk of catching COVID-19, and you don't really see them taking preventive measures seriously.
Yeah. Well, we notice, I think there's a lot of similarities, actually. We notice people are hesitant because of various factors and are afraid of the hospital. In our research, we find reasons like more people are going into the hospital than coming out or something is so wrong with the hospital. So these are the sentiments coming from our public, that they're thinking that the hospital is going to amplify or increase infection rates or infectious diseases, anything. They're just afraid to go to the hospital, and we get that as well. Why is the vaccine making us sick, but you still get the virus if you get the vaccine, right? This is a big question as well. The other thing is, what's the point in making myself sick if I'm just going to get the virus anyways? What types of programs are in place to help educate the population on the reasons and benefits of these vaccines? Is there...
Yes, so we are really having such concerns here, and even more concerns concerning the vaccines. We are really trying hard to put in different programs or measures. So that's not only the Ministry of Health, but with partnerships as well. For example, with World Health Organization, UNICEF, Save the Children, and other different partners, especially in giving civic education to the communities. So we have radio programs specific for COVID-19 vaccination. So they give messages and then people are given chance to ask questions. We have also engaged different people. So for example, in Malawi, people will trust the local leaders more or the religious leaders more than they trust the health workers. So we have also involved such people in making sure that sensitizing the people on the importance of getting the vaccine and what the vaccine does to them. So we have also used other people that have already received the vaccine in the communities, used them to also give messages to the other people in terms of the importance of getting the vaccine as well as the side effects. So such people are also given a platform to tell the other people what side effects they encountered and how the side effects went away in a few days. So that's mainly those are mainly the platforms that we're using. We also have television, and then we also have different programs by Society of Medical Doctors in Malawi. So there are different and many platforms that are being used to make sure that sensitization is being done. But I must also say that we still have a long way because hesitance is still there. People are still getting misinformation, or people are still being misinformed from different messages going on in the social media, for example, WhatsApp. So they spread those messages and the people trust them more than they trust the healthcare workers.
There's that's very interesting. So I want to talk about expired vaccines for a minute and the hesitancy surrounding that issue. How big of a problem was this in Malawi with these expired vaccines? And is there a discrepancy in hesitancy between the uneducated and educated? I think we kind of touched on this already, but rural versus urban.
So mainly it's about the perceived risk. So urban areas were affected more by COVID-19 disease than the rural areas. It's mainly because of the congestion in urban areas. Urban areas are more congested than rural areas, so transmission was higher in urban areas. That's one of the reasons. And the second one is also testing capacity. So urban areas have easy access to COVID-19 testing as compared to rural areas. So those were the reasons. So urban people living in the urban areas know that they're at risk of catching COVID-19 and what COVID-19 does. And people living in the rural areas, most of them are still in denial, and then maybe COVID-19 did not hit them as much. So that's what has caused the discrepancy, or had caused the discrepancy between urban and rural areas in terms of vaccine hesitancy. So even now, we are seeing that the districts, even the rural areas, so rural areas that were really affected by COVID-19 in the just gone well, are more receptive to the vaccine than rural areas that did not really see COVID-19 cases. So it's mostly due to the perceived risk that the people have towards COVID-19. And that has really affected the hesitancy in the country.
Yeah, thank you. Okay. Well, I'm concerned about when distributing vaccines. Can you think of bringing the vaccines to the people or helping the people to get the vaccines? Like, I mean, what measures are being put in place so that people can get access to the vaccines?
So in terms of distribution, the country has, I can say it has a very good distribution system in place. Maybe we may lack certain resources, but when it comes to COVID-19, we've tried, because when the vaccines just came in, we received the vaccines. We distributed the vaccines to the districts the day after we had received the vaccine. So we received, for example, if we had received them on Saturday, that means that on Sunday all the districts had the vaccines in their vaccine stores, and then the districts were distributing them to the health facilities. So that's the normal distribution system that the country has. When we receive vaccines, they are kept at the national vaccine store, and then they are distributed to the zonal or regional vaccine stores where districts go to collect the vaccines. But for COVID-19 vaccine, it was different. It was the national level distributing to all the districts. So I'm pretty sure that when it comes to distribution, the country is doing well, but maybe we might need support in terms of equipment to distribute the vaccines. We are really trying to make sure that the vaccine reaches the person that is in the most rural areas. So that is being done through, for example, we are doing door-to-door vaccination campaigns. People, vaccinators who are community workers, are really going to households, and they are asking if there are people that are not vaccinated, and then offering the vaccine right there at their house, so that they don't really struggle to go to the health facility. So that has also helped in making sure that the number of vaccinated people in the country goes up. And other things that we're doing, we're going to churches, and we know that people will receive the vaccine better when it has come in, the message has come while at church, and the religious leader has endorsed the vaccination, and community markets as well. So the vaccine is not only available in hospitals or clinics, but it has gone to the communities. So those are some of the measures that we have put in place.
That's really interesting. A quick question about the religious institutions. Do you get any pushback from any of them, or are they all pretty much cooperative?
No, we have a majority that they're really cooperative. So it's both for Christian faith and Muslim faith. We have seen Muslim leaders also supporting us by telling their followers that the vaccine is safe, the vaccine is accepted in their religion, and other Christian leaders as well, especially the traditional Christian churches. They are really receptive to the vaccine. But I can't say that we haven't met any resistance. We're still meeting resistance from other churches and religious groupings that are not accepting the vaccine for different religious reasons that they have. But we're still continuing to engage them so that they also allow their followers to get the vaccine. But that's also a problem at some part, because we've lost people and we continue losing people. So even the statistics that we're having now in terms of people being admitted in critical care, people dying from COVID, is mostly those that have not been vaccinated. So we are really working hard to make sure that we also, all the religions accept the vaccine.
Yeah. Okay. So I want to talk about the vaccines available to Malawi. Are you confident in saying that they are safe and effective? Is there any vaccine technology, i.e., the mRNA of Pfizer, the adenovirus, AstraZeneca, weekend virus, which is the traditional vaccines, that you are concerned about for public safety?
Um, so far, for the vaccines that we're using in the country and vaccines that are yet to come in the country, so we have AstraZeneca and Johnson being used, and we are going to receive Pfizer vaccine soon. So for vaccines to be approved in the country, there's a committee. There's a committee that recommends these vaccines to the government after noting that the vaccines, looking at the data and seeing that the vaccines are safe and effective or efficacious. So that's also the same for the national regulatory authority in the country. Before they give an approval to any medical product, including vaccines, they also look at the safety and quality, safety, effectiveness, and quality data to make sure that the vaccines or the product is really safe. So even for the approved vaccines in the country, they underwent the same process, looking at the information, looking at the data, and then looking at what World Health Organization has said, because we also work hand in hand with World Health Organization, and even the vaccines that are approved in the country are the ones that have been pre-qualified by the World Health Organization. So far we're pretty confident that the vaccines that we're using in the country are safe and effective. As the Ministry of Health, we're also on top of our game at making sure that we look at the safety data. We look for signals that may indicate safety issues in the vaccine. And so far, for the vaccines that we've used in the country, haven't encountered any serious adverse events following vaccination that are linked to the vaccine. Of course, we have the common side effects or fever, headache, which are common, but we have not received any safety issues or safety reports concerning the vaccines.
Right. Okay. So how does the approvals of vaccines coming from the United States, the WHO, and the UK? How much confidence or what additional sort of screening or measures do your approvals look at when considering vaccine approval for Malawi?
So first of all, we may have. So for example, we may have a general. As I had said earlier, we may have a general data or information for the vaccine, and then the National Regulatory Authority also looks at the lot clearance. So they will look at that lot and make sure that it was cleared by the national or the regulatory authority where the vaccine is coming from. And if they are also working with World Health Organization, make sure that it is also cleared from that part. We don't have capacity to measure or check the vaccines in terms of quality in the country, but we use the information that we have from the originating country in terms of the vaccine safety and quality information. So that's what happens. But the vaccines must be approved by the National Regulatory Authority first before they come into the country.
Right. Okay. I do have something that's a little interesting, and it's about the malaria vaccine. Are you aware of the malaria vaccine that was the WHO has just recently approved?
Yes.
Okay. So my question is, how does the approval process for malaria differ from the COVID approval, would you say?
So I would say that it will also take a similar process. And for the malaria vaccine that we're using in the country, at the moment, we were conducting phase 4 studies on the effectiveness of the vaccine when used in the greater population. So it was the same. The vaccine was pre-qualified by World Health Organization. Before coming into the country, they had to submit their data, their quality data, their safety data, the efficacy data, which was reviewed by the National Regulatory Authority. After that, then it was approved. So that was also following recommendation by the Malawi Immunisation Technical Advisory Group that also recommends vaccines to be used in the country by the government so that they consider such vaccines and introducing such vaccines in the population. So it's almost it's the same process for all the vaccines.
Okay, well that's actually okay. So that's good to know. There's now, what about the low vaccine rate? So we say 3% of the population is vaccinated. Okay, what kind of timeline would you guess for scaling up the numbers? You know, what is there anything on the horizon that you can anticipate?
So we are really optimistic that we're going to scale up the numbers, and at the moment we are hoping that maybe by the end of this year we'll have more numbers, and somewhere in 2022 would have vaccinated about 20% of the population and aiming higher for a higher number so that almost everyone in the country is vaccinated. There are different measures that have been put in place, the ones that I had explained, and that has also even shown in the daily vaccination coverages, because previously they were a bit lower, but now we have a steady number of about 7,000 people being vaccinated or getting the vaccines every day. And we're sure that if we continue at this pace, most of the population will be vaccinated very soon.
Right. Okay. Well, at this point, I'd like to ask some questions that were submitted beforehand by the audience. But before I do, I want to get into the student questions. But just one further point I see that's coming up here. Did you say that it's mostly the elderly getting the focus at this point?
No. Currently, it's everyone. So all the people that are willing to get the vaccine are getting, as long as they are above the age of 18. So when the vaccine was being rolled out, we had mainly concentrated on the healthcare workers, elderly, and those with comorbidities. Currently, it's every person that is above the age of 18 and they're willing to get the vaccine, they get the vaccine.
Okay, really good. Okay. All right. Again, so then at this point, we'd like to ask some questions that were submitted beforehand by the students. Just so that we can get as many questions as possible, please try and keep the answers condensed, okay? So the first student question was, how large of a role has COVAX played in distributing vaccines in Malawi?
So that's a very big role, because the vaccines that we received in the country, most of them have come in through the COVAX facility.
Okay, very good. Okay. Do you agree that deploying mobile vaccination centers will help increase vaccination uptake to get Malawi to the 60% vaccination rate they are aiming for by 2022?
Yes, so we have already started that, and we are going to continue doing mobile vaccinations, going to the markets, to schools, prisons, villages, everywhere we can find people, so that we give them access to the vaccine.
Okay. What do you see as the single biggest challenge to raising the vaccine rate in Malawi?
Vaccine hesitancy. That's a very big problem, and that really needs to be worked on. As I said earlier, we are targeting the whole population. So and vaccines are now available. But the problem is that people do not want to get the vaccine.
Okay, on August 3rd, CNN reported that the Delta variant had spiked COVID-19 cases by 80% in Africa. In comparison to the initial COVID-19 outbreak, how is the healthcare system in Malawi handling the Delta variant? Is the presence of the Delta variant creating more incentive through fear or contracting the new variant for individuals to get vaccinated?
So yes, so I can't really say that I have evidence that the current wave or the just gone wave was due to the Delta variant, but it really created demand for the vaccine. So when we got the vaccine would have very long lines of people wanting to get the vaccine. And when the number of cases of COVID-19 started dropping, then the demand for the vaccines also went down. So it did create a demand for vaccines.
Okay, do you know if there's any structural limitations that have made distribution and consumption of the vaccine difficult?
So at the moment, I don't think that distribution, especially when we had the vaccine in the country, distribution was the problem. Maybe within the district, maybe there could have been a lack of transport or inadequate transportation. But what I know is that everyone at the moment is putting COVID-19 vaccination and the disease as a priority. So even when there are transport constraints, we've heard people making sure that they get a vehicle that can maybe redistribute vaccines from one facility to another in the same district. But for the distribution from the national level to the regional level to the district level, that has not been a problem.
Okay. Well, how does your work at the Ministry of Health influence your perspective on vaccine distribution programs, such as COVAX, vaccine safety and efficiency, et cetera?
So I think my work there has opened my eyes because before I went there, just before I went to the Ministry of Health, when the COVID-19 vaccine was coming in, I thought that the ministry wouldn't be able to distribute the vaccines in a day, but I saw that it happened. The vaccines were distributed from the national level to all the districts in the country within one day. So it has opened my eyes. Things that I thought that wouldn't be done, I saw them being done.
That's really good. Okay, well, we're getting towards the end of the show, or we're at the end of the show, and I want to thank you very much, Esther, for your time. Unfortunately, we are running out of time. So before we go, I would like to give you a chance to address our audience and students and beyond, and leave us just with some thoughts about some takeaways that you'd like to let the audience know about.
All right. So maybe the first message that I can give is that we have seen that vaccines really work when it comes to preventing vaccine-preventable diseases. And in this case, COVID-19, we have seen that those that are vaccinated are not getting as sick or are not really dying from the disease as compared to those that have not been vaccinated. So our wish is that every person should get the vaccines, regardless of where they're coming from, whether it's from a low-income country or a higher-income country. And we are really grateful that we have vaccines in the country now, because we had a moment where we did not have any vaccines, COVID-19 vaccines, and people were just waiting for the vaccine. But we're really grateful that we have the vaccine now from the COVAX facility. My hope or my wish is that we still continue having the vaccine in our country, and that vaccines, even in the whole world, will be shared equally between the rich countries and the poor countries, so that by the end of the day, each and every person in this world is protected from the pandemic, because if every person is protected, then we're all protected. But if we leave other people behind, then the risk will still be there for the world to be affected by this pandemic.
Again, thank you for joining us today, Esther Chirwa. It was a pleasure to have you. We'd like to thank the audience for joining us today, and we'd also like to thank our sponsors. This podcast series is part of an epidemic ethics WHO initiative, which has been supported by FCDO Welcome Grant 214711/Z/18/Z. We'd also like to thank Professor Nicole Hassoun for her executive production, Dr. Ryan Holtz for writing and production, along with interns Carolyn Kaczynski, assistant producer and marketing, Ariana Rodriguez, assistant producer, writer, Elizabeth Van Tassen, assistant producer, Noah Ms. Arachi, assistant producer, Jenna C. Fuse, assistant producer. I'm your host, Daniel Sanderson, and I hope you enjoyed this episode of Talk is the Best Medicine.
We hope you enjoyed this episode. To find more of our content or explore the exciting work being done by our parent organization, the Global Health Impact Project, you can check out our website at global-health-impact.org/new in the description below. The Global Health Impact Project hopes to continue to support efforts like this podcast to provide information about and advocate for access to essential medicines. Also follow the Global Health Impact Project's social media pages on Facebook, Twitter, and Instagram. Until next time, don't forget, talking is the best medicine. We hope you enjoyed this episode. To find more of our content or explore the exciting work being done by our parent organization, the Global Health Impact Project, you can check out our website at global-health-impact.org/new in the description below. The Global Health Impact Project hopes to continue to support efforts like this podcast to provide information about and advocate for access to essential medicines. Also follow the Global Health Impact Project's social media pages on Facebook, Twitter, and Instagram. Until next time, don't forget, talking is the best medicine.